Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about a unfortunately very common blood pressure and the increased risks of an unfortunately very common cancer in women, and specifically that has to do with breast cancer. But even more bothersome is the conclusion by the authors in this particular study. But let's start by talking about beta blockers, which are a class of drugs that can they have traditionally been used for blood pressure, but they can also be used for managing the rhythm of the heart. Now, we're talking about this specifically for blood pressure because you start talking about it for managing the rhythm of the heart, it's a different discussion. But beta blockers, for a long time now, have been shown to increase risk of things like stroke and diabetes, which diabetes then increases your risk of everything we're trying to protect against. It's just crazy that this drug is still used, but I still have patients coming in that are on beta blockers. Think of the OL drugs. Things like atenolol is one of the more common. Metoprolol, bisoprolol is not as common here in the United States, and then propranolol is another one. But atenolol is probably the one I see the most common. But patients are still written prescription for these, and when I tell them that it increases the risk of, I want to say it was like 22% increased risk of stroke and 12% increased risk of diabetes or reverse, but either way, it's a concern because those people who have high blood pressure, they're already pre-diabetic or diabetic and at risk for stroke. So giving them a drug that you were supposed to be protecting against certainly seems to be absolutely contradictory to what we think we should be giving a drug for. Then we toss in this particular study out of Sweden, and they looked for the increased risk of breast cancer in people taking beta blockers. And in particular, they found a pretty striking increase in people taking the beta-1 selective. So atenolol is on that list. Propranolol is not on that list. But they found in some cases almost as high as a tripling, so 300% increased risk of breast cancer in the women that were taking these beta blockers. And breast cancer is already way too high, so to be taking a drug that will further increase your risk, that's certainly a bothersome challenge. The propranolol, which is a non-selective beta blocker, also increase risk when combined with other blood pressure medications like ARBs or ACE inhibitors. So I think the thing that bothered me the most was the conclusions of the author in this study. And basically their conclusions were, well, this is what we see, that these blood pressure medications increase risk of breast cancer. So we should just put increased focus on detecting breast cancer in these patients. And that's where we're so wrong in medicine. It's like, okay, well, this drug will increase your risk of breast cancer, but let's not fix that. Let's just keep an eye out for the breast cancer when it does show up. And that's what we're missing in medicine these days. Instead of thinking, oh, well, let's just keep looking for breast cancer more often, we should just fix the underlying problem. That would make more sense to me, or switch from a beta blocker. There's certainly other blood pressure medications out there that will probably be just as effective without increasing the risk of stroke, diabetes, and now breast cancer. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.